So the idea of today's presentation, I wanted to keep it really informal, and at the same time making sure that we go through a few things which we are mostly aware of. Some of the things that are in the subconscious mind, which we are trying to work on to ensure that we have an environment where it is conducive for us for learning, work, leisure, and also for the well-being. So the two key features of today's presentation I'm going to focus on is well-being and resilience. So let's go through it. So to start off with, I am a rural procedural general practitioner. So I'm a GP. I work in a practice here in Bathurst. I am also the director of emergency department at Bathurst Hospital. And I am also a procedural anesthetist in the hospital, providing anesthetic services locally up here. And I do have special interest in mental health and try doing pastoral care for my junior colleagues in the hospital as well. So being in Bathurst today, I just wanted to make a quick acknowledgement again. So we acknowledge Wiradjuri elders, past and present, and all members of the Wiradjuri nation, the original custodians of the land on which the Bathurst and surrounding communities reside. So the idea of this talk is to create an awareness on mental well-being. So when we talk about mental well-being, there are three different concepts that we're talking about today. One is mental health, which we hear all the time, mental illnesses, and we are talking about what's called as mental well-being as well. So the key aspect of today's talk is going to be on mental well-being. And that's the reason why we have these flowers, seeds, and plants that is shown growing in our supposed brain. So to start off, I would probably want to start off with what's defined by the peak body World Health Organization on mental health. So mental health is a state of well-being. So it is definitely a state of well-being in which every individual realizes their own potential. So what is your potential? Wherein you can cope with normal stresses of life, can work productively and fruitfully, and able to make a contribution to her or his community. So the key aspect here is that everyday life is bound to be having stress for all of us. We do have to go through a lot of stress on a day-to-day basis. The key here is to see if we are able to function fruitfully to achieve what we need to achieve and contribute to the community. And that's what we're going to be working on, the well-being part. And obviously, we are not dealing with mental illness or mental health disorder. And that's something that is beyond the scope of this discussion. But obviously, we need to differentiate this so that we are aware of what we are achieving through this conversation today. So why is it important? Why is well-being important for all of us? There are multiple reasons why it is important. There is evidence to say that people with high levels of mental well-being, they are able to learn better, they are more creative, they're more productive, there is more pro-social behavior, and it pretty much combines as a overall well-being for not just the person, but the person's immediate family and friends, and obviously to the community and to the outer social circle. So it percolates. Hence, it is important for that individual person to be able to be in a positive state of mind, to improve their physical health and life expectancy, which in turn will benefit their family and the larger community as well. Obviously, mental health is very complex. And what we need to remember is that if someone has been diagnosed with a mental health condition, does not necessarily mean that they are not in a state of well-being. So, and also at the same time, if there are people who don't have any mental health diagnosis, you can't assume that they are in a state of well-being. It is quite important for us to understand the three concepts of cognition, emotion, and social health. The way we feel, think, and develop our relationships, which is what helps us to create that feeling of well-being. So the idea of this talk was, it came through in terms of the COVID struggle. So talking through being in the hospital system, talking with my patients, inner circle, family, friends, now obviously with personal struggles as well with what COVID has given all of us. So we are all, when I say the word struggling, I don't mean that we are having a difficult time through all the time through COVID, but there are multiple uncertainties. And these uncertainties do affect our well-being. And that is something that we need to be mindful of, and how we deal with this is quite important. So when I was talking to one of my junior medical staff and also one of the medical students, so I asked them, what is it that you're feeling during this COVID times? Because we have medical students who come down here. We have got interns, we call interns, residents, and registrars. So most of them do come from different hospitals and different settings. And people come from Sydney, come from Melbourne, they're from Dubbo, Orange, let's go, you name the place, they come from different places. So at certain point in the couple of lockdowns that we have had, they have had an opportunity to understand their emotional makeup, and at the same time they have struggled with some of their common symptoms that we see, which could be worry, confusion, it could be guilt, it could be annoyance, it could be uncertainty, frustration, feeling upset, feeling angry. There could be multiple things. So and it could be due to many reasons. You could probably have just a bubble where you could see one of your very close friends. Your family might be far off in different parts of Sydney or overseas, unable to see them. Obviously, we do catch up virtually, but it's not the same as catching up face to face. It changes your biological makeup, because you might be someone who would love to go for a 8K run in the morning. You're unable to do any of that. So you're stuck at home in front of your treadmill and trying to run on the treadmill every day, which is not the same as going out. You might not be an essential worker, which pretty much means that you're unable to go out except for some essential reasons, which is probably not what you are. We are human, we are social beings. We love our social network, and we love what the world has an opportunity to give us in terms of interactions. So eventually these symptoms can provide you with a lot of negative emotions, we call, which could be mood swings, feeling irritable, having difficulty sleeping, being preoccupied with illness or probably emotional detachment, fears of recurrence, self-blame, fatigue. I've seen a lot of people come back and tell me that, doctor, I feel really fatigued. I'm tired. I don't have the motivation to do things. So, and these are all common negative symptoms that we are seeing on a very large basis in our population. Hence, we come to the topic of what's called as stress to start with. So, obviously, for different reasons, when life gets difficult, we slip into what's called a survival mode. So, I was having a conversation with one of my patients a few weeks ago, and the opening statement was, "Doctor, I feel really stressed." And then I said, "What do you mean by stress? What is the reason why you feel this way?" And that open-ended question brought about so many emotions. I have a job. I feel I'm not able to focus on my job because I'm in constant fear of COVID. I've got a family. I think about the past and what happened, and I think about the future. I'm in between the past and the future, and I'm not able to focus on the present at this point of time. And I've tried to focus, but every time I try thinking about what I could do differently, I slip back. And my biggest worry is, what if I catch COVID? This is obviously pre-vaccination. And what if I catch COVID? What if something happens to me? What happens to my family? What happens to my friends? What happens to different people around? So this stress, a thought process where you are stuck worrying about something, and where you're putting all your energy into these things that we fear, can preoccupy you to such an extent that it can take you off your normal day-to-day routine, which could include brushing your teeth, playing with your family, having a shower, praying if you're spiritual, going about your daily activities. It can pretty much change your way of functioning, which unfortunately leads you into the cycle of more fear, because your healthy lifestyle is broken into. So I did go through a few simple tools about what we could do to cope with stress when it comes to COVID-19. Simple steps which include paying attention to your reactions. So it could be that you're somebody who's a very calm person, and out of the ordinary, sometimes you might just have this impulsive conversation where you say a few things which you don't mean. And that could probably be a trigger for different things. However, being conscious of your reaction and understanding what your emotions are at that point of time is the key to ensuring that you can actually come out of the cycle. And that's what we'll be working on today. Take a break and relax. So when you go play a game of soccer, cricket, basketball, whatever you want to play, you end up having an ankle sprain. So the next question you obviously ask your doctor is, when can I go back to playing? It's a good question. But the first question that the doctors want to know is, how long can you rest yourself for? So when your bone is bruised, your body is bruised, or your brain is bruised, you need a break. You need to come out of that cycle to understand the present situation, so you don't actually fall back into the past and the future cycle. Obviously, limit some information. When I say limit information, you've got so much exposure to social media. It could be your Facebook, Insta, your WhatsApp, your TikToks, whatever it could be. Some of the information that you get through here could probably play on your mind for different reasons. You're also used to waiting for a premiere at 11 o'clock in the morning to find out number of patients affected with COVID, what happened with the number of deaths, how long is the lockdown going on for, and then that takes you to, all right, COVID-19, what's happening with COVID-19? It's good to know the information, it's good to know where you can get your vaccination, it's good to know how you are going to manage yourself with this COVID-19. However, trying to sit idle and trying to go through multiple other situations, what's happening in Victoria, what's happening in Zimbabwe, what's happening in the rest of the world, and how many people are dying. It is unfortunately a very sad situation all over the world, but how can we break this cycle for yourself and for your community is the key. So being kind to each other is very important, and obviously a healthy routine, which we'll talk about soon, and connecting with people, not the virtual connections, the real connections. So if you feel like you want to talk to someone, unfortunately, obviously you're in a bio bubble or you're in isolation, whatever it could be, you could still pick up the phone and call them rather than text them. And having those conversations really make a big difference. So I want to read. Sorry, was it a question? Sorry, I missed that.
Devji, is there any question? I think it's by mistake.
Not all good. Thank you. Sorry.
And one question. Do we ask question till the end, or can we ask people to send it to our
Whatever is easier, I'm quite happy to do it either ways. Whatever is easier, I'm very flexible with it.
Thank you. So I would request everyone to send questions on the chat. We moderate it to the end. Thank you.
So, and again, coming back, so we are humans, we are not eternally happy. And it's not about keeping ourselves happy, it's about keeping ourselves to a point where our emotions are better controlled. And that's what we're working on. So when we talk about emotions, there are different emotions we talk about. They are just psychological states which comprises of how you feel and what your thoughts are, how do they change, how you express your behavior, and what these behaviors mean to you, and how are you inclined to act on it is what we're working on today. So it's important to feel all these emotions. They're like butterflies. Some of them are butterflies that you actually like in terms of the color and the way they do things, and some of them you probably think of they're just normal beings for you. But catching and appreciating the ones that you actually want to savor for the long period of time is what is true happiness. And identifying those emotions that give you positivity is what we need to work on. So obviously we're all aware of some of the common emotions that we have. Feeling happy, which provides you with hope, optimism. It makes you feel thankful for who you are, makes you smile, makes you happy, reduces your stress, makes you feel energized. And on the other hand, feeling sad, just the opposite of how you feel when you're happy, makes you feel hopeless, disappointed, symptoms of feeling low, crying, lack or loss of interest in things that you normally enjoy. Another emotion is fear. Again, when fear turns up, you go into the survival mode where you get this fight, flight, fright response. You might sweat, you might tremble, you might have chest discomfort. So, and another one is obviously anger. So feeling a sense of aggression, unpleasant feeling, feeling like you want to have the fight or flight response again, frowning, teeth grinding, maybe feeling physically charged for the wrong reasons. So multiple emotions we come across. It could be disgust, or it could be surprise. So they're all different emotions that bring about different aspects or facets of how you feel. And that's why I just wanted to go through this mapping emotions, where you can see that happiness is more of this orange color that you could actually see, to the neutral, where you probably are not as blue as you are when you feel depressed. So that's how the emotions have been mapped in a body. And we also call it as the misery mapping. And they've done a lot of studies around the world. It could be Australia, it could be the United States, it could be Indonesia, and a few other countries. And there's an interesting article that I came across, which I thought I should share it with you. So they have found that mental health was a better predictor of misery compared to multiple other things. If you have a look here, they've got Australia in green, Britain in blue, and United States in orange, and Indonesia in slightly off orange. So as you can see, the mental illness diagnosed, or they have visited doctor with emotional problems, which is not mental diagnosis, but it could be excessive stress, burnout. That's a bigger predictor of making people feel a sense of misery compared to unemployment, poverty, lack of social interaction support, including having a partner, physical illness, or educational outcomes. So mental well-being it plays a really big impact on how people feel and what they do. And hence we come to this point where we want to work on building better mental health and how we do that. So building better mental health, we are working on a few things. A sense of contentment. At the end of the day, when you finish your day and go back to sleep, it could be a morning for a night shift person or a night sleep for a day shift person. You should feel a sense of contentment. Have an ability to laugh. for silly things. Just one of the kids saying something cute in front of you should bring about some form of happiness. And the key is resilience, which is to address the stress and bounce back. And bouncing back from adversity is what we really need to work on to find this happiness and find this sense of well-being. Obviously, a sense of meaning and purpose in both your activities, relationship, and work is very important as well. And all of that stems from a fact that your self-confidence and self-esteem makes a big difference, eventually getting you to have a positive outlook on life. So I have got 5 simple ways in which we can actually connect what we call it as getting your mental well-being. The first one is obviously to connect. So your social connections are very important. It could be your team that you play sports with. It could be your one of the clubs that you are actually passionate about. It could be something like SEWA, where we're all so passionate about bringing about change in your society. And the second component is obviously to stay active. And I say stay active, not actively watching television, not actively watching what's happening with IPL. It's about actively doing something physically energizing for you, combination of exercises for your heart and for your muscles to keep you going, because the evidence is enormous on how physical activity makes a really big difference to keeping your well-being. The other key aspect is taking notice. This is such an important topic, also called as mindfulness. In Buddhism, they talk about what's called as past is history, future is mystery, present is a gift. So taking notice of the present is very, very important. We'll come up with a small exercise at the end of this presentation about what mindfulness is, which will be quite useful to have a chat about. And then keep learning. It could be something that you're doing. If you're obviously an electronic engineer and you want to further progress, you might want to do more in your field, learn more, get into more courses that you think are useful for the job that you're doing. Or it could be after work that you're passionate about. It could be a musical instrument that you love. It could be a sport that you want to play, or it could be a combination of all of this. Make sure that you keep yourself energized. One of my mentors, he has been a doctor for the last 40 years, and he, even till date, he obviously is still practicing. He's a procedural rural journalist, general practitioner who has got vast interest in a lot of things. He runs a farm. He has got special interest in obstetrics, anesthetics, general practice, education, social work, and he ensures that he goes to multiple places around the country where there are limitations or there is difficulty finding medical professionals to help the community. So combination of things that brings us to what's called as giving back to yourself. When I say yourself, being kind to yourself, giving back to the community. So, and it's an extremely, extremely, extremely grateful thing that you can actually do. Very gratifying. Definitely helps you in terms of feeling better about yourself. So giving is a very useful tool, which we'll work on soon as well. I did have a few video clips, a few short video clips, which I thought were very relevant to this. And unfortunately, I think we've got some issues playing them because they are not they're not playing as well, with the volume control being an issue. So I'll definitely send a link to the presentation if you are keen to watch a couple of clips. So going through to mental well-being again, we've spoken about connections. We've spoken about gratitude, about giving back. We spoke about mindfulness briefly, and the key concept that we're talking about is what's called as resilience, and that's what we'll be working on today. So, and there was another beautiful video which I'll probably explain briefly. So there is this class where one of the teachers comes up with this what we call it as a Bodhi doll. Bodhidharma was the doll which doesn't have the arms and legs, and you try to make it fall down, and it actually pretty much comes back and stands soon after you push it back. And that's what resilience is all about. It does not mean that you do not go through bad times. We all have disappointments. We all feel a sense of sadness, anxiety, and stress. But however, the ability to bounce back from these adverse events is the key. It takes a lot, and I can say that from my personal and professional experience to this COVID-19, it takes a lot to bounce back. It could be a lot of personal trauma. It could be a lot of professional stress that you get through. However, having that defense mechanism in you, where you do all the right things with your connections, with giving back to the community, focusing on mindfulness, it builds resilience in you. Again, resilience is an ability to recover from or adjust easily to misfortune or change, and that's what we're working on. So, putting your setbacks aside and keep working towards your goal, the short-term and the long-term goal, which, if it has multiple dimensions, it could be physical, emotional, social, and spiritual dimensions, it actually lasts a long time for you. So it's important to ask this question. If you have a friend, if you have someone, people might be putting in a happy face in front of you because everybody's going through the same. They might don't want to trouble you. Okay, they might think that, oh, Sean is facing the same as I am facing. We probably both will be losing the job. I don't want to burden Sean with my emotions. That's not true. Asking that question, are you feeling okay? It's a useful tool. It's a very useful tool. Okay? So it does not hurt to ask the simple questions. Are you okay? So some tips for building resilience. It's quite important. So we have gone through the connections. We've gone through well-being. We've gone through a purpose in life. And that's what I was talking about, a short and a long-term purpose, which the evidence says that if it does have a spiritual dimension to it, I'm not talking about religion, I'm talking about a spiritual dimension. It could be a combination of meditation or yoga or whatever you think is a spiritual dimension for you as a long-term goal, would definitely help you in terms of building this resilience, which is useful. So I've just gone through a few simple tools in terms of building resilience, which I'm happy to pass this slides on. They're all very self-explanatory. Whatever I'm talking about today is something that you're all aware of. You're all knowing what to do and when to do. But however, what science proves time and again is that sometimes it's useful to just go through those elements that keeps us going and reminding our subconscious mind that these things are something that is quite important to us, will make a really big difference. So key features, obviously, keep open-minded. Focus on your task, but be flexible. No, it's good to be a perfectionist, but at the same time being flexible about and flexible and realistic about how and when you want to finish your goals. It's quite important. Simple things: eating on time, eating healthy, getting enough fruits and veggies, having a nice sleep, spending time with your quality time with your family and friends. So it could be a board game, or it could be just going out for a walk in the park when possible, or it could be just saying hi to your neighbors. Would be something that will probably help you to get the relationships strengthened and the confidence and the positive affirmations, which will probably get you more resilient. So the 4 parts in your inner circle: the sleep, gratitude, getting your connections right, and reappraisal, which we'll talk about soon, with physical, emotional, and mental well-being, where we talk about getting the right emotional mind frame for you to go through and be resilient is what we need to work on. It's a cycle. So you come up with optimism, you and the optimism says, yes, this is what I would be doing. I'm happy today. I feel like I want to go. And then you're emotionally aware of what you feel. So talking to yourself and internalizing those positive emotions is the key, which will provide you a control of yourself to respond to circumstances and situations. And obviously supported by your social network, and with a calm mind and feeling happy and well about yourself with self-belief will get you to where you need to be. And these are all positive emotions which feed into each other. And that feeling is quite important. And I had this really good video by Mr. Rao, which I thought I'll probably talk about, where he talks about our life being what we call it as it's like being a civil engineer, he says. It is fantastic. He's a happiness guru, which is a wonderful terminology. What it talks about here is we have a road that we need to build from A to B. And between that, we've got a forest, we've got uneven ground, we've got probably some mines, we've got multiple objects around us. We are asked to build a road from A to B. You've got two options: get angry at the forest, get angry at the mines, and get angry at yourself and say, this is ridiculous. Why was I asked to do this? And then pull back. Or this is your road. You can build it. All right, there are some issues. I have to probably dig deeper. I'll either go over the forest or underneath or through the forest. Obviously, it might take a bit more time and energy and a bit more money probably to get the road built. But obviously, I will build it. So that is what resilience is all about. Flexible thinking, rewiring your emotional thoughts, being optimistic about doing it, not being overly optimistic about doing things that you think is beyond your control at this point of time. Having the positive emotions, having the right connections to actually help you achieve your goal. And obviously having to balance your work-life balance at the same time is the key to get you to where you should be. And that's all resilience is all about. So getting those right connections, and the beauty of actually holding each other's hands eventually comes back to the fact that you are holding someone else's where someone else is trying to hold your hand. The 3 R's, we call it as, for resilience is relationships, routines, and obviously getting to the resilience part of things, which will help you to solve problem better and able to understand yourself better and deal with stress better as well. So I can't stress enough about physical activity, which is really, really important. Obviously, it's got benefits for your health and well-being, and reduces risk for a lot of metabolic problems, what we call it as heart disease, diabetes, depression, joint problems like arthritis, certain cancers. It can reduce the risk of all of these by just being active. So it could be in the form of walking, running, swimming, cycling, climbing up things. It could be a hill, it could be stairs, it could be swimming. So it's important, really, really important. If you have an opportunity to utilize public transport when it's safe, it will give you a better opportunity to go for a walk or get more physical activity. So try to squeeze some physical activity, which will make a really important impact on your well-being. Releases endorphins, makes you feel better, get your health a very good kickstart, and also provides you an opportunity for getting to meet people. And when things open up, probably going for a bike ride with a few other mates, or probably playing a game of badminton or table tennis, and that's good for your social networking and at the same time good for your physical activity as well. So this is what we say to people: what is the physical activity that you need to do in terms of vigorous activity? So please make sure that you reduce your time sitting, because you've got everything in a house. Got a big plasma TV in your house, which pretty much gives you an opportunity to go and watch digital TV, every kind of sport, Netflix, Amazon, you name it, you have it all. However, it will take you off your social connections, your physical activity, your mindfulness. So it's quite important to get back into it. So that brings me to mindfulness. As I've told you, it's a very simple concept of being in the present and thinking about the present. One of the simple exercises I tell people is, it's important to have a piece of fruit every day, which is good. So I would take an example of having an apple or a banana. I've even kept one ready for showing to people as well. So your five senses, when you have a fruit, you're looking at the fruit, you're actually feeling the fruit, you're feeling the skin of the apple. And when you're biting into the apple, which I don't want to eat in front of you and make you feel jealous at this point of time. So you're actually feeling the taste through your teeth grinding, your tongue relishing the apple. At the same time, you can hear you're chewing your apple through your hearing as well. So you're trying to stimulate all your senses. So when you're doing that, it's quite important for you to be in the present and enjoy and feel how you taste the apple. So that's just one of the examples of how you can incorporate mindfulness into your everyday life, which makes a huge impact on what's happening around you. So that's the key. So different ways of doing it. Some people do it through breathing. Some people do it through exploring the thoughts and feeling, detaching themselves. Some people do it through movement, whatever works best for you. But try to incorporate it into your daily life, in your busy life, which will be very helpful for you. You can do it throughout your day with whatever you're doing. When you're walking, you can feel your arms moving, your head nodding or turning your head to the other side, feeling your neck, your shoulders, every part of your body, which is important. That brings us to the key aspect of sleep, which sometimes we ignore. It's not about how many hours you go to sleep. It's about the quality of sleep. Do you have enough quality of sleep to wake up in the morning to feel refreshed, feel rejoiced to go for another day? If not, what is it that might help me to get a better sleep is what I'll be working on. Simple things. Eat your meals around the same time every day when possible. Dinner should always be 2 to 3 hours before bedtime if you can. Limit naps during the day if you can. Stay physically active. Avoid coffee, tea, coke, other stimulants if you can. So keeping off drugs, alcohol, and cigarettes if you can would be ideal to help you to get a good night's sleep as well. And having the gratitude and being grateful for what we have is really, really important. Thanking anybody that you want to thank. It could be your parents, it could be your partner, it could be your children, it could be your family, friends, your boss, or it could be anything. Waking up is a blessing. Able to have a job is a blessing if you can. Bringing about a change in the job and making impact on people's life is a blessing. So being grateful for what we are and who we are is the key, which really gives you the sense of satisfaction. So one of the games that I tell people when we talk about the JMOs is the gratitude game, where name a person you're thankful for, name a place you're thankful for, name a food you're thankful for, name a thing you're thankful for, and name anything of your choice that you are thankful for, which is a really useful tool that you can actually incorporate and probably teach your younger generation as well, which would be really helpful for them to understand concepts of gratitude, concepts of resilience. And that's how we actually build up the next generation. So expressing gratitude is very important. You can do it by different ways: writing a journal, saying thank you in person or the phone or email. Pray for that person. Pray for that person who has actually been helpful to you. And at the same time, it will help you to put things in perspective for you. It improves your empathy. reduces your anger and aggression, strengthens relationship. People understand that this person has stood back to acknowledge what I've done for that person. So it makes a huge difference. All I did today was spoke to one of my colleagues who I could see that was obviously very stressed for different reasons. So all I did was just had a quick chat and said, "Are you okay?" And another 5 minutes of conversation made a huge impact on this person. And I think that sense of able to do things and being grateful for the opportunity that you've been given to do that is quite important. So obviously, being grateful will help you to get your immune system stronger, helps you to have a higher level of positive emotion, and helps you to be more forgiving, reduces the social isolation, and makes you more compassionate. And that's what we're working on. We're working to evolve to be better human beings than what we are today. And a concept of reappraisal about things like you have a stressful event, the stress is appraised. You've got an option of mindful state of awareness where you know that I have some stress. I understand and acknowledge it. Let me use my resilient tools. The resilience tools, I'll connect, I'll talk to one of my mates, I'll go for a run so that it helps me to relax so I can think clearly. I'll stay in the present to see what I can do differently. And I'll probably think about utilizing different tools to achieve what I need to achieve, and then come up with a plan. And that plan will help you to evolve a strategy for you to work on this. That's what's called reappraisal, utilizing your tools for well-being and resilience to achieve what you need. Any number of times, just a quick question, are you okay? And that's what we've been doing in our hospital system to make sure that people around us are looking after each other. And we are there for our colleagues, our patients, making sure that they're okay. So are you okay is a question that people will recognize and open up to you, and you can make a difference in someone's life. So how do we do that? We are in this together. Get some fresh air and sunlight to start with. Think positively. A mission to find 3 positive things each day. It could be something very trivial. It could be something majorly important for you. It could be anything that you think is positive for you. And implement some healthy habits. If you already have healthy habits, make it healthier. And getting a good work-life balance is important. Making sure that you're grounded, you turn off, turn on, switch off, switch on from work to home, home to work. It's quite important. Incorporate a few minutes of having a happy, light-hearted chat when you can. It could be a 5-minute break. It could be listening to music. It could be anything that you love and that you enjoy. That's what you need to be doing. And there are some really good resources. This Way Up is a useful tool for some online cognitive behavior therapy that we call. And Humankind Meditation is a really useful tool where you have free guided meditations, which definitely is a useful tool. So take some time out, look after your people, remember resilience, remember Bodhidharma we call, which is about making sure that you have the ability to bounce back when you have had a fall, physically, emotionally, or psychologically. And that brings you to look after your well-being and reach out. There are plenty of places where you can reach out. You can talk to your friend, colleague, family member, the GP, local hospital, psychologist if need be, family and friends, support groups, plenty of places that you can actually reach out to. And some of the articles that I did utilize for this presentation. And thank you very much.